I'm Houston Landry. I'm the COO of Allied Anesthesia in Dallas, Texas. We wanted to be able to kind of seamlessly be able to collect pre-surgery fees from patients for anesthesia services. The surgeon typically collects ahead of time, the facility typically collects ahead of time, but we typically don't have the opportunity to do that. This made it a whole lot easier because Clarity ties into the practice management system that the surgery center that a lot of our work comes from utilizes, so it was a whole lot easier it's been a whole lot easier to get prepayment from some of these patients. So typically we want to have the name and demographic data of the patient ahead of time so that we can reach out and collect payment prior to surgery. In some cases, we're able to get that. In some cases, we're not. Or in some cases, the patients either stonewall or won't return the call because they don't know who we are or why we're calling them. So this has made it a whole lot easier for our staff to be able to reach out to those people kind of seamlessly. The Clarity does it for us. Make several contacts with the patient prior to surgery, and if all else fails, Clarity will reach out and make a phone call, and if all else fails, then we will. But the opportunity for the patient compliance is a whole lot greater. There's more points of contact. So in essence, Clarity is serving as one of our collectors, for lack of a better term, and freeing up my regular collectors to go chase old payments, patient balances, insurance balances, discuss things with insurance companies. So it's been great for that. I would assume so. We all are the last to find out. We don't get to pick our patients. We don't get to pick our surgeons sometimes that we work with based on the relationship with facility or if it's a relationship with the provider. So we're all kind of left sort of holding the bag at the end of the day sometimes. We're often the last one to bill the patient for a procedure and they've already paid, so they don't want to pay. So collections can be difficult depending on certain factors, but I imagine that this is pretty much a common issue with all of us because we don't get to dictate the type of surgery we work with in most cases, or in some cases, we don't get to pick our payer mix. So for Medicare, for example, this is very big, making sure that we collect all that money because we don't want all of it, we want all of it. I think we're excited, especially the billing team, because it's going to free them up to pursue old claims, resubmit claims that may have been denied for whatever reason. It takes almost a full-time person's task away from that person to free them up for other things. And it's been really effective so far. It's pretty much worked mostly as advertised for what we've signed on for. Right now we're only using it at one facility because there's a direct interface between Clarity and their practice management system, and that's been awesome since we don't have to really do data entry for demographics, and Clarity handles the communication and the payment, and it's so far worked really well. So the top reasons for Clarity is it obviously does the work for you. It frees up your staff to go on to other high revenue generating tasks, and it gets that money in the door prior to surgery. We all know that once surgery is over, collecting money after the fact can be a hit or miss proposition in a lot of cases. So this takes a lot of the guesswork out for us. It's not 100%, but it's a whole lot better than having somebody on the phone calling patients asking for money when they're insisting they've already paid for everything because they've paid the surgeon and they've paid the facility. Who the heck are you? So it's removed that burden from us. We did think it was possible, we just didn't have the bandwidth to go do it and the staff manpower to go do it. So this has been a very good positive for us. In the first day, we collected just under $2,000 in prepayments, which is great. That was in essence free money because it really cost me almost nothing to go get those $2,000. And ever since we've rolled it out, it's kind of trended along that same collection path, and I think it's been a great thing for us. I thought it was great. I've done a ton of implementations with practice management systems, EMRs, other software in healthcare over the years, and this one was very smooth. The implementation team knew what they were doing. They answered all our questions. They were on time with everything, and I think in some cases some of the delay was actually on our side. So very pleased with how they've handled it. The training was great. The support so far has been great. The follow-up has been great. No complaints at all.